What are the most common neurological issues in children?
Children are just mini adults. Children suffer from nearly the same diseases as adults. उनके अंदर एक डर रहता है,
Unconscious.
अटैचमेंट का दुख रहेगा, साथ में एक उनको ये रहता है कि कहीं मेरे से तो कोई गलती नहीं हो गई।
Medication at home, watching social media or watching YouTube, because that is very, very dangerous.
स्पीड के साथ आप भी कंज्यूम कर रहे हो, मतलब इट्स नॉट ओनली द चाइल्ड हु इज कंज्यूमिंग सो मच ऑफ डिजिटल, मदर इज आल्सो कंज्यूमिंग। मदर चली गई तो उसको फर्क नहीं पड़ रहा, मोबाइल चला गया तो ही
So true.
ट्राई,
So
मतलब तो क्या किया हमने।
welcome, Dr. Mitalee, and I thank you so much for taking our time from your busy schedule. And I would love to hear it from you, like what exactly are you doing and what are things that you're working on recently? Can you share that with us, please?
A very good afternoon to all who have joined us today, and a very, very warm hug to you
Thank
for
you.
being such a nice host. And before this, whatever we spoke and all, it was really nice talking to you. And also, I would like to thank your team for taking up such sensitive topics. Why? Because these are actually burning topics and which are affecting our lives in a day-to-day basis. So with that, I would like to say that I am Dr. Mitalee. I am a senior neurologist in Care Hospitals, Bhubaneswar. It is one of the largest corporate hospitals serving people across India. And I am specialized in neurology, which includes brain and spine. I
Amazing.
take care of patients, I take care of adults, and we have to deal with strokes, we have to deal with epilepsy, we have to deal with movement disorders, and neurology is a specialty which we have to do after completing your MBBS and after doing your MD in medicine. Then you have to do a super specialty course in neurology. So this is the basic thing, and we are ready to go.
So you are great, great, great doing. I mean, I'm overwhelmed by listening what all you are doing. You're making such a big impact from Bhubaneswar to the entire world, I guess. So quickly, I'll ask a couple of questions respecting your time and effort. So my first question to you would be, what are the most common neurological issues in children, and how can parents recognize early warning signs?
Yeah. See, children are just mini adults. Okay. Like children suffer from nearly the same diseases as adults. So they can have pediatric strokes, they can have pediatric headaches, that is migraine also, and they have a variety of other things also, like which is coming up, like pediatric hypertension, pediatric diabetes, pediatric obesity, and of lately, so much increase in the ADHD spectrum. They also suffer from epilepsies. They suffer from birth defects, which is something more common with pediatric population. For birth defects related to the heart, related to the brain, related to the any body organ. This is something special with children because we get to identify these birth defects as they grow older.
Okay.
So this is a little newer in the pediatric population.
So, Dr. Mitali, I've been working with children and mothers specifically, and I address a lot of ADHD children for counseling sessions. But I think still it is a taboo to tell that my child is hyperactive, to tell that he has ADHD. Lot of parents do not accept this. What is your one advice to the parents to detect if you have any symptoms and observation? Mother is like the first person to detect any change in behavior in their children comparing to other children of the same age. But heart in heart, she doesn't agree. Like she कि मेरे बच्चे के साथ ऐसा नहीं हो सकता. So what is one advice as a neurologist to the parent, like why early addressing of the issue is important?
See, for a mother, the child is the king of the world,
Yes.
okay, or the princess of the world, like your son or daughter. So, mother accepting the fact is often difficult. We have to understand her emotion. We have to be in her shoes to understand why,
Yeah.
while we are pointing out some defect or some disorder or some misalignment in the child, especially when you are dealing with a
Absolutely.
sensitive mother, because some mothers are overly sensitive. Nowadays, you must be observing a trend that most of the parents are actually having one child or two, maximum two. Previously, it was not in previous generation. People used to be five, six children, and the mother's attention used to get diverted in
Yes.
so many children.
Yes.
Also,
So true. Yeah.
so does her emotional investment. But now, heavily invested in one child. Both the parents are heavily invested. Not only parents, the grandparents are heavily invested. So, and moreover, this is very particular to our society. If the child gets out to be little different from the normal, often the mother also gets lot of taunts, a lot of like, तुम्ही में कोई defect होगा,
True.
your upbringing was wrong. That is a hidden, उनके अंदर एक डर रहता है,
Unconscious.
अटैचमेंट का दुख रहेगा, साथ में एक उनको ये रहता है कि कहीं मेरे से तो कोई
Maybe
गलती
just.
नहीं हो गई, मैंने कहीं कुछ गलत तो नहीं खा लिया था, मेरे कारण तो ये नहीं हो गया, मतलब दिस mom guilt is always there in
Absolutely.
mothers. So this part has to be dealt really, really very sensitively. So apart from that, whenever we are raising awareness about any defect or disorder, we should always raise a caution with that. कि
Yes.
हो सकता है कि जो कि आप डेविएशन सोच रहे हैं नॉर्मल से, हो सकता है कि वो जस्ट थोड़ा डेविएशन हो, नॉट नेसेसरली अ डिजीज और डिसऑर्डर. You
Exactly.
must not self-diagnose a disease or disorder and start medication by seeing just online
Yes.
something.
That's
And
happening.
yeah, in the fear key of in the fear key, people will come to know what if I take my child to the doctor, people will know, and so many my relatives will know that my child is a
My child
patient who
was
is going to for a doctor for this and that.
so
So
true.
they often, I have seen mothers, they start self-medicating their children, not
My,
only with some XYZ home preparation, but also with proper medication, which can be dangerous because we are dealing in and out with patients. No? So that's why I want to make this point also. Please do not do that. What you are thinking that is deviation from the normal. There is every possibility that it is not. It's just a deviation from normal, not a disease or disorder.
absolutely.
Please, please, please do take a professional help. This is something I want to underline and highlight in bold that please take a
Thank
professional
you
help
so much for
before
addressing.
deciding on.
Thank you so much, Mithali, for addressing this. So, so the first sign, if you see any deviation from, same age group children, must address it to a pediatric, and maybe pediatric can tell you to go to a psychiatrist or to a
Yes,
neurologist. And
yes.
there are certain scales and tests through which personality development, all these milestones are checked, and then they'll tell you that what next steps would be. Do not start any medication at home watching social media or watching YouTube, because that is very, very dangerous. The mg, the size of the medicine, what density you use it, it's not a common man thing. It has to be addressed by a specialist. So one more thing, Dr. Mitali, recently we saw an incident gone very viral on internet. An 8-year-old girl in school got a heart attack, and nobody recognized the sign and symptoms. So what are the three top reasons for children getting heart strokes?
See, they can be having some underlying cardiac conditions. लाइक
Okay.
जिसको हम लोग बोलते हैं कि दिल में होल है या फिर उनकी आर्टरीज संकुचित हो रही हैं या
Okay.
फिर इट कैन बी अ डायलेटेड कार्डियोमायोपैथी. इट कैन बी ड्यू टू सम ड्रग्स आल्सो which maybe have been administered. So there are various reasons. हो सकता है they must be having a history of exertional dyspnea, like while running, if the child is just panting for breath or getting a loss of consciousness beforehand due to any reason which was unevaluated, these things can be an important reason. And cardiac arrests can happen in a very good fit heart also, because there is a thing called arrhythmias. Suddenly the heart structure is normal, but there can be rhythm disturbances which
Okay.
can suddenly cause cardiac arrest also. So it has to be evaluated, and that's what I'm saying. A child is a mini adult. They can almost suffer all the diseases a adult suffers. So we have to be vigilant, and we have to have make like the schools also very much educated
Absolutely.
with all these kind of things, like what should be done if there is suddenly loss of consciousness, there is suddenly epileptic attack in a school, or if the child is not paying attention,
Yeah.
what has to be done immediately, because there is one thing which I would like to highlight called absent seizures, which happen a lot in children. They will be
Yeah.
looking at the board and they are suddenly out, and
Yes.
your teacher is talking to the child or interacting, and that child is suddenly like out of focus for some time, and
Super.
then immediately comes back starting from the same. That is a very important sign of absent seizure. So this has to be picked up. This has to be picked up. That you cannot just start scolding there. Yeah, you are not listening, not listening. Just get it evaluated.
I think, Dr. Mitali, that's amazing thing that you addressed, that schools should be equipped enough to at least give first aid to such emergencies, because due to stress, junk food, digitalization, a lot of things children are experiencing which we never heard 10, 15 years back. So I think that's one advice to all the schools who's watching this, to have at least specialized workshop just designed for children and teachers, that what should be the first aids and what are the signs and symptoms you can observe if the children are zoning out, or the children are getting, suddenly getting zoned out into something. So what all action needs to be taken, and what is one precaution we should do immediately if somebody sees a child is having a heart stroke? What is the first thing we should do?
First thing is keep the child in a safe place, especially if the child is having a seizure or something, it is jerking of the body. At least remove any kind of pointed object. Do not overcrowd. Do not overcrowd. If there is a second person, the first person has to be with the patient, with the child only, because you cannot leave the child to call for help. Immediately call for help. A second or third person should actually record the event so that they can show it to the doctor or the clinician actually what happened during the event, because nowadays lot of schools have CCTV
Yes, yes.
footages also. This can be actually helpful retrospectively to know what happened. And if the patient is having a proper seizure or something, then it should be taken into a left lateral position, and so that, because oral secretions should go out, it should not be lying on the front position
On
for
the left.
seizures.
Okay.
And airway breathing should be checked, and it should not be clamped like people are just ऐसे करके पूरा घेर लिया है,
Crowded नहीं
ऑक्सीजन
होनी चाहिए.
कट ऑफ हो रहा है, पूरा पेशेंट का ऑक्सीजन कट ऑफ हो रहा है उसके ऊपर, और मुंह में अंदर कुछ भी नहीं डालना चाहिए, लाइक पुटिंग समथिंग इनसाइड द माउथ, लाइक योर दिस शो इन द मूवीज, नो दैट मोजा सुंघा रहे हैं, जूता सुंघा रहे हैं, चम्मच डाल रहे हैं, दिस थिंग
Not
शुड
even
नॉट बी.
water. Not even
No,
water.
nothing, nothing. Don't give anything. When
Nothing.
there is an epileptic seizure, okay, or a seizure I'm telling. So what happens? This is the second variety in which can happen with dehydration in normal school assembly. Suppose the child falls
Yeah.
suddenly, immediately take him and make him flat and raise the leg and up. It improves the blood supply to the brain.
Okay, okay.
And after the child is fully conscious, then only you should give anything by mouth. As a drowsy state, may patient unconscious or not responding, you should not put anything inside the mouth, because it can aspirate and go into the lungs. That is, it can be dangerous. It can cause choking. Okay. So that's why nothing should be given by mouth. And third important thing, if you are like, you should not panic and you should try to see the pulse. Pulse is in the hands. So but these things require training, because you
Train.
understand, if you set the pulse in a wrong place, you will see that there is no pulse. So you
Yes.
understand. So these things require short trainings, which can be actually done through webinars like your organization, or schools must invest on these things, I believe, for at least
Yes.
getting in touch with like physicians and knowing what is to be done basic on a hands-on manner, that what they can do. If everything looks like very difficult, inform the parent and take the patient to the child to the hospital, so that the best hands will decide what next.
Immediate action is must. Rather than
Yeah.
panicking out, immediate action is must, and nothing to put in the mouth, and always seek for best advice and professional advice. So,
अगर कुछ समझ में नहीं आ रहा है, इतनी चीजें याद रखना भी मुश्किल है, just carry the put it in left lateral, put the child in left lateral position, bring the child to the hospital, nearest hospital. If there is something, suppose there is a immediate heart attack, you have to know CPR.
yes.
Understand CPR, you have to check the pulse, you have to know where to press the sternum for the proper cardiopulmonary resuscitation. CPR trainings are done by a lot of hospitals, like basic life support that only provide, if they are aware of these trainings, then only they can help. No, otherwise they are just bystanders. They are just
Yes,
looking at it. They cannot do
absolutely.
anything.
Absolutely.
Sudden falling, and they do not know to check the pulse. They do not know how to give a CPR.
Yeah,
So it's better
absolutely.
you transport that child to the nearest healthcare. At least, even if the pulse is feeble, if the oxygen is still running, they may make the patient revive, and the child can survive in some cases.
I remember when we were growing, the medical rooms that we had only could have helped us with the cold cough or maybe
Yeah.
maximum fever. But now it's a
Hmm.
necessity, I guess. It's not luxury, but I would call it necessity to have basic trainings to the teachers in the lab to have CPR, to handle seizures, the first actions at least, and to how to address it. Thank you so much, Mitali, for sharing this. Hello, parents. If you find our podcast relatable, educational, then do subscribe to our channel. In the comment box, write your parenting challenges. We'll try to address them one by one. And never forget to share it with amazing parents like you. Because remember, by learning together, we can raise kind, confident, and connected children for happy families and happy nations.